Peripheral vascular disease, or hardening of the arteries, affects about 10 million people in the United States.
Varicose veins or venous disease are even more common. However, people sometimes dismiss the symptoms as part of normal aging.
On this week's Health Talk, you'll learn to identify the symptoms of venous and peripheral vascular disease, and you'll learn about early diagnosis and treatment.
So stay tuned, we're up next.
Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Our topic today is the diagnosis and the treatment of venous and peripheral vascular disease, or disease of the blood vessels. Our guest is Dr. Ali Rizvi. He's a vascular surgeon with the Western Connecticut Health Group, Western Connecticut Medical Group.
Welcome to the show. So Ali, this is a really important topic, in part because it affects so many people, and in part because it can really cause significant quality of life issues for people.
Of course. So peripheral arterial disease affects approximately 10 million patients a year in the U.S. The risk factors are the same as most vascular surgery risk factors, which are smoking, high blood pressure, high cholesterol, not exercising.
Yeah, I think we actually have a graphic that we could bring up to summarize some of the risk factors as well as some of the symptoms. But peripheral vascular, it's a system-wide problem, isn't it? It's the vessels, it involves the vessels of the entire body.
Absolutely. So the vessels in every single part of the body get affected, which is, they cause a little plaque.
And here are the risk factors if you want to go through them again.
So the risk factors for peripheral arterial disease are history of smoking, diabetes, advanced stage, high blood pressure, high cholesterol, weight, and family history of peripheral arterial disease as well.
And again, this is a pretty common issue. It's interesting, we often experience these symptoms, and I think we have some of those in the legs. Is this because these are the longest vessels in the body, and and why do we get leg cramps before we have problems in our arms?
Of course, yeah. So one of the most common things we see in our office, patients coming in with leg cramps. You have to decipher if it's venous, if it's arterial, if it's something else. If it's
so unexplained leg cramp pain or cramping, especially with exercise or walking, because the muscles aren't getting enough blood, so
yes.
they complain. And
so the leg foot wounds that are not healing, and again that could be due to arterial because the blood's not getting there, or because the wounds aren't healing because the veins are just not allowing the blood to go back up to the heart. Or there's skin problem discoloration, which sort of comes along with the veins not working well. The best way to kind of address all of these is to speak to your medical doctor, and then have a thorough discussion to see if you need a vascular surgeon to further take care of your symptoms.
Okay, we have some more pictures, I think, of what these things actually look like, at least.
Schematics.
So the schematics. Yeah, so this is what venous disease looks like. Maybe you could say a little bit about the normal pumping of blood and
Sure.
what happens with venous disease.
Sure. So the veins in the legs and everywhere else, they pump the blood, so the blood then goes back up to the heart to get some more oxygen. In patients who have varicose veins, a lot of the veins in the legs are just not able to do that. They're bringing the blood up, but the valves don't work, so they're allowing the blood to fall back down.
And actually, the veins themselves don't really have a pumping action of themselves. They're
Yes.
squeezed by the muscles.
Around.
And so these valves take what is inadvertent squeezing and keep the blood they make the blood go in one direction only, up.
Yes.
When the valves are damaged, it can go both ways, and
Right, so
you
it
end up
causes-
with swelling and discomfort and ugly veins, which a lot
Yes.
of us get as we get older.
Yeah, so that's what we see. So patients who have leg swelling because the pump didn't work and their veins don't work well, so they have leg swelling, they have discoloration, and they can develop wounds at the severe stage. And if they do, there's specific ways of treating them as well.
Let's pull up the next slide, because we've got, and these are what varicose veins look like. On the left, I guess not everybody, but a lot of people, women get them often after pregnancy, I guess because the uterus is big and the baby
Increased
presses
pressure.
on the veins, and so they show up as these curly Q veins. So they're not just a cosmetic issue, they actually can cause some discomfort.
No, they're not just a cosmetic issue. You're right. So there are varicose veins, and you see the one on the right side of the screen, which is after treatment.
Oh, okay.
So the right side of the screen, it usually takes, it's not an immediate effect. It takes a couple of weeks, it can take a couple of months for it to get this way, for it to improve completely, significantly. So vascular surgeons do offer complete spectrum of arterial and venous disease treatment. We also offer cosmetics. So if you do have spider veins, we do treat them as well. But the leg cramps, if they're coming from these varicosities, we have to look for the specific problems, and then we can help you treat them.
Maybe you can talk a little bit about that, because there are
Sure.
different other reasons potentially that people have leg pain when they walk.
Yeah,
so sometimes that can be.
Pull up the next picture too, because this is the other cause
So one of the other causes is peripheral arterial disease, which means that calcium is getting built up in the arteries, as you can see with the yellow plaque in the artery in the middle of the boxed out image. And then the blood's not able to flow properly. When it's not able to flow properly, the muscles in the calf usually are not able to receive the blood. And if they're not receiving the blood, you have pain. Think of just walking over to like a mailbox. At the end of the block, you're trying to go out to the mailbox. Every day somebody goes, and about right before they get to it, they have leg cramps. They have pain on the way, and then they stop for about 5-6 minutes, and the pain improves, and then they walk back. And go back to the porch, again they're having pain because it's the same distance. That's called claudication. So that's when the muscle is not receiving enough blood time at a certain distance. That's one of the earlier signs of peripheral arterial
So
disease.
pain with exercise, and that doesn't mean the soreness that you get after you've exercised on the weekend after sitting around all week.
Right.
We're talking about really moderate discomfort in the muscles when it's almost like angina. I'm using the angina of the muscles instead of the heart.
Yeah, so it's the muscle not receiving enough blood supply after doing a certain amount of work, and that happens exactly at the same time, same distance every time. Or same amount of exertion of exercise every time.
And do people notice over time that it causes less and less exertion to cause that pain?
Correct. So as it gets worse, it can cause less and less exertion to get the same pain to come back. Or it can cause wounds. And once you have a wound, an ulcer, a break in the skin, then that becomes very difficult to heal.
Maybe you can tell our viewers a little bit. So if a patient comes to you with concerns about claudication, what kind of testing or evaluation do you do?
So first thing is, again, telling them if they're smokers, stop smoking, and making sure they're on their aspirin and making sure they're on their cholesterol medication and blood pressure medication. The risk with peripheral arterial disease is the leg is not going to kill you. It's the heart that's going to kill you. So you have to make sure the heart is treated properly.
Well, and that's a really important point, because what you're saying really is that all of those factors that affect the vessels in the leg also affect the blood vessels in the heart and can cause a heart attack.
Yes. So we have to make sure that's some peripheral arterial disease is a marker for heart disease. So you have to make sure that's treated properly. Getting back to this, if you do have claudication, which means you walk and you have pain in a certain distance, we can first start you on exercise therapy, which is 30 minutes of exercise, supervised programs to help you exercise at least 3 times a week. And eventually the goal is your muscle starts using less oxygen to do the same work.
I was going to ask how that works, because I know that there's very good evidence that people with claudication get improvement with just simple exercise. And I didn't quite understand the physiology of that, or the pathophysiology. So it said the muscles are actually using less oxygen. You're not correcting
Or more efficiently.
Right, so muscles are just able to use the oxygen more efficiently. If you have claudication, it's not an emergent need for any sort of surgical procedure, big or small or anything. The first thing is medical management and making sure the person can get back to their daily life. If they're not able to do so, or if the symptoms get worse, there's always medications. There's a medication which can help improve the distance that you go over a 12-week period that you can travel. If that doesn't work, vascular surgeons can offer minimally invasive options, which are done in the operating room, but they're done, and the patient can go home in the same day and get back to their normal life the same day.
Are those open procedures, or can you do angioplasty on the peripheral veins of the leg?
Yeah, so they're angioplasty of the peripheral of the legs, arteries in the legs. We go in and we see where the blockage is, and if there's a blockage, we open it up. And if you have to put a stent in to keep it open, stent is a metal object. If it's going to keep it pushing out to keep it open, we do that. If we need to break up the plaque with an atherectomy device, we do that as well. And all these have shown different modalities of treatment.
Let me ask you, back in the dark ages of medicine, I remember them doing these aortofemoral shunts, where they put a prosthesis and run it subcutaneously. It was a big operation.
Yeah.
Patients, it was a risky, actually, a lot of patients had complications with it. Are you still doing those shunting operations, or do you not need them with all of these intravascular approaches that you have now?
So the goal of all this minimally invasive therapy is to avoid a big procedure. But vascular surgeons are trained to be able to do all big procedures. So not only just we do medications, we start with medication and conservative therapy for all our patients. Then we go into minimally invasive procedures. If that's not able to treat the problem, we always have the toolbox open, and we can always go back to some bigger surgery, which is an invasive option, which requires a scar and an incision in the skin. And then, you're right, then we can put a plastic tube or your own veins to try to connect the arteries to give the blood supply back to where it's needed.
We talked about the these interventions helping with claudication. What about with wound healing?
So, if the problem is that the blood is not getting there because of the blockage in the arteries, then it would be the same treatment. You can still, if there's a wound, the first step is trying to heal the wound, and if it doesn't heal, you try minimally invasive options of angiogram and angioplasty, which means looking at the blood vessel and opening it with a balloon. If you need a stent, you get a stent.
And so, do vascular surgeons often work in concert with wound care centers?
Yes. Yeah, so we have an excellent wound care center as well, and we work with the wound care center to help assess the correct patients. It's always a team approach. So you need the medical doctors, you need the wound care specialists, you need the vascular surgeons to be able to treat all these patients for.
I think that's so important.
And how about, we talked a little bit about venous disease, so if we could just switch a little bit and go back. We saw those varicose veins on that patient, and they got much better. What did you do? Or what is your approach to treat? Is the old stripping the veins? Are you still doing that, or do people? I know about intravascular sclerosis. Tell us a little bit about the modern approach.
Yes, I mean we can still do the stripping. We don't do them anymore, but we can still do them. It all depends on why the patient has the varicose veins. So we do the ultrasound first to see if what the problem of the varicose veins are, and the vein that's causing the problem, which is usually not the varicose veins. Some varicose veins are a symptom of a different vein not working well. So we treat that vein first. The main vein that's causing the problem, we go in, we'll puncture in a needle, and we can seal it shut with either heat, or we can break up the vein on the inside and try to seal it shut that way. Once we do that, then the varicose veins should get better. And if they don't, we can always take the veins out.
And tell us a little bit about those spider veins you talked to. What exactly are those?
Absolutely. So vascular surgeons are not just surgeons who do maximally invasive surgery or minimally invasive surgery or give medications. We also do cosmesis. So if it comes into cosmetics, where you have people have spider veins that are bothering them, we can always inject sclerosing agents, which means sort of agents, a detergent, alcohol-based or detergent-based, which can sort of help you erase those spider veins.
So the spider veins actually scar down; they don't carry blood anymore.
Right.
And so, and I know that scarring is used a lot to treat venous disease, and we couldn't use that to treat arterial disease because we need that arterial blood flow. But on the venous side, we are able to scar down the ugly veins and still have enough venous return to be healthy. Tell us a little bit about the different anatomy. Why does that work?
So the veins that are usually causing the problem usually go down the middle of the leg. These veins that cause the varicosity, like I said, varicosities are sort of signs and symptoms of a different vein not working well. They carry about 5% of total blood volume. If we can treat the vein that's not working well, the blood reroutes to the veins that are working well, and this way you don't have that problem.
So there's so much redundancy in the venous system that you just don't need those extra veins.
Make the blood go in a different
So you can
place.
make them scar down, and then they turn into scar tissue instead of ugly bulges.
Absolutely. But there's always some times where patients have both arterial and venous disease at the same time, and then they have a wound. If that's the problem, sometimes minimally invasive options are not the best treatment. If we just treat the vein and the patient still has the wound because the arteries weren't very good, then the vein is gone. You eventually want to save the vein, if you can save it, unless you need it. So in that case, it's better to have a discussion with the vascular surgeon and the medical doctors to figure out exactly what's the best approach to all of this.
And I think we have to end on that, but I think it's just so important to recognize if you have a wound that is not healing on your leg, that there's a problem. There's a venous or an arterial problem. You need to have that evaluated.
Absolutely.
They should heal abnormally.
Thank you so much.
So unfortunately, we're all out of time for now. We want to thank our guest, Dr. Ali Rizvi, for joining us on Health Talk today.
Please do send Eric and me your questions and comments about HealthTalk at wchn.org. We'd really love to hear from you.
Thanks for watching.
Stay well.